Sensitive healthcare professionals who care for people facing serious illness and death understand how important it is to know the cultural, emotional, and spiritual needs of each person in their care. They practice what is called palliative care. The World Health Organization defines palliative care as an approach that improves the quality of life of patients and their families facing a life-threatening illness through the prevention, assessment, and treatment of pain and other physical, psychosocial, and spiritual problems.
Hey, it's treatment time, huh?
Ellen FINK-SAMNICK is a social worker at the Virginia Hospital Center. She works with people who need a ventilator to breathe. When it becomes clear that a person is not going to get better, difficult decisions are made.
The first thing social workers learn in their training is patient right to self-determination. You can't help someone move forward or help them feel comfortable with a situation until you, the clinician, understands where they're at in their thought process and belief process. And that certainly applies when you're working with patients and families.
What I think is really difficult is how do you engage them in the conversation, that you can't use the same techniques and the same tools and the same messages if you want a Latino or an African American or a Chinese to open up, because there are cultural contexts for those discussions. And they don't usually happen as we are sitting here talking one-to-one.
I'm Dr. Echo.
Sometimes it will be a taboo because as a children, if you mention this to your parents, now they'll think, are you curse me to die earlier, or what are you talking about? So it's a taboo. People must be very careful. I'd rather suggest through the third party, like a social worker or medical doctor or lawyer.
What language do you speak? Tell the doctor what languages you speak.
Spanglish.
Spanglish.
Spanglish?
I think every patient is an entity in his own, and we need to know the patients closely before we can determine how we should approach the problem with them and with their family.
Heart disease has slowed Lucille Bryson down, but it hasn't dampened her spirit.
I've lived a long life, and I have to say, thank God for that.
Lucille's failing health has forced her to sell her parents' home. Soon, she'll move into an assisted living complex.
Yes, I'm going to miss it, but not that much to slow me down. I'm going to start a new life.